Hi, my name is Monica Maftei. The course code is ACMVET 403A Case Studies. I have chosen today to do the blood smear procedure and the deep quick staining. The equipment used for this procedure is the microscope slide, gloves, and that's to reduce the risk of pathogen transmission, the fixative, the stain solution number 1 using, and the stain solution number 2 methylene blue. There's a 3 ml syringe, a 22 gauge needle, and the vacutainers. Now, this procedure is used to produce a sample that might be sent to an external laboratory or used in-house to be examined for differential white blood cell count or cellular abnormalities. The sample has been taken from a large dog via the lateral saphenous vein. The right forecranial surface has been clipped and the area of the needle aspirate is cleansed with 2% hepatane and wiped at least 20 times to reduce the risk of inflammation of the vein. For venipuncture, we selected a 3 ml syringe, chosen due to its plunger withdrawal length and the quantity of blood required. Although a 22 gauge needle is commonly selected, needle size may vary to the visualization of the saphenous vein structure. Okay, now with the EDTA tubes, so we have we have the EDTA tube to maintain cell morphology, and then we have the fluoride oxalate tube, and that's used to preserve glucose in whole blood and for some special chemistry tests. The red top tube is used for collection of serum for selected chemistry tests, as well as clotted blood for immunohematology. Now, the blood sample was stored in a fridge for 2 to 4 hours. Smear can be stored in the fridge as well before it's sent to IDEX labs, as it can get foggy if you store it in the fridge. Now I'm gonna do the procedure. So we draw a bit of blood. And the smear is done. Now, now for the smear, to fixate the smear, we put on the gloves. First we use the fix and we dip it in 5 times. 1, 2, 3, just let it drip. Then we use the stain solution number 1, the using 5 times, 2, 3, 4, 5, and stain solution number 2, methylene blue, 5 times as well. 1, 2, 3, 4, 5. We'll let it drip as we did in with the stain solution number 1 as well. And then we just rinse it off with some distilled water. Just let it drip. Place it on a napkin. And dry it. We try and do this 3 times. And then we let it air dry. Now, for labeling the slide, we take the glass off. For labeling the slide, we have the slide cover, which we put a label on it. We just place the animal's name and the last name of the client, today's date, and the date of birth of the animal, and at what time the procedure was done. And then we just place the label on the smear cover, just like that. For documentation, we have the IDEX book where we fill in all the fields required. And of course, everything goes on the client's file as well. After we have used everything, we put the lids on. We try and clean everything up. Now, the syringe, because it still has some blood in it, it goes in the biocan, biohazard, and the needle in the sharp collector. Gloves the same, depending if they have any blood on them, we can put it in the biocan, or we can just throw it away in the bin if there's no blood on it as well. But because there is a little bit of blood on it, I'll just chuck it in the biocan. And they go in the bin. Everything will go back to where it will belong. Put everything away. So now we use chlorhexidine 5% solution to wipe the bench. Wipe it the best you can. All the edges is very important. And after this, we throw this in the bin and we wash our hands. Here we wash our hands.